Hi, this is David. I'm going to be doing my presentation on Hispanic culture. Introducing my client. My client's a 69-year-old Hispanic gentleman. He's married with three grown children. He's got many grandchildren. His medical history includes type 2 diabetes, hypertension, hypercholesteremia, neuropathy, PAD, and reduced kidney function. He's with rehab right now for a below-the-knee amputation. He immigrated to the United States in his 20s. He's been married once to his wife since then. Understands most English, but he rarely speaks it. Typical characteristics of Hispanic culture. Communication is very important. A lot of respect has to be shown, both verbal and nonverbal. Physical touch and casual use of first names, neither are very appreciated. With the healthcare provider, these patients are rarely aggressive or assertive. Direct disagreement just doesn't happen very often. This is usually it manifests itself as silence or non-compliance. They're going to listen to you, but do what they want. Social relationships, family is the most important thing, and this is almost universal in Latin communities. Very strong reliance on extended family. Men have a strong sense of machismo, which is a sense of honor for men. It's not necessarily a little boy being macho, but it gives them a strong sense of responsibility toward their family, and that makes them somewhat the authority in the family for this exaggerated sense of responsibility. The women, both idolized and oppressed, they're pretty much the force holding the family together. They're seen as, the central part of the family. They're a source of the wisdom in the family. The family looks to them for advice often. But they're also victims of violence very often too. This comes from the machismo part of the men's characteristics. Religion, most Hispanics are Roman Catholics, about 20% are Protestant. Strong magico religious beliefs, and these are kind of magical practices intended to cause a supernatural being to produce or prevent a specific result. These could be candles or pictures of the Virgin Mary, stuff like that. Health practices. Good health results from luck or reward. They see God as rewarding them. Disease is seen as an imbalance, hot or cold versus hot or cold. Their healthcare beliefs tend to involve. They're not opposed to traditional medicine, but they want to keep hold of their culture too. They value their culture and the blending of folk and traditional medicines. Diet. Beans, rice, and beef. Not a lot of vegetables except tomatoes. Acculturation tends to lead to a more American diet. It has more fruit, but it also has a lot more rice in it, and it contributes to obesity and diabetes. It's just very prevalent in this population. Pregnancy and children. It pretty much falls on the women and the female relatives. A man might, or a husband might go with his wife to the clinic, but it's more often a female relative. Death and dying, the beliefs that outside forces are going to help them are common. God, especially in the Catholics. Similarities in my patient and his family. The family spends every night with him. It's either a daughter or a son. His wife visits a lot, but she's not in the best health herself. They're very supportive of one another. The family's Catholic. There's a picture of the Virgin Mary on the TV stand. This family appears to still eat a more Hispanic diet. They take this resident out a lot in the afternoon and early evening, but they tend to go home rather than eating out, which a lot of families just go out to eat. The foods left to him are bean-based dishes, appear to be traditional Hispanic dishes. When asked about their father's condition, the son replied, "We worry and we pray for him." Um, Kind of indicates that they're relying on God to take care of their family. The family sees modern medicine as valuable, but they still, the picture of the Virgin Mary and the faith. They still have a lot of faith that their father's going to be taken care of. The daughter speaks very respectfully to the father. Um, I often have to ask a lot of questions to get the information I need. The father tends to deny pain or anything that's going on with him. I have to ask several different ways to get him to tell me what's really going on. The father's very respectful of the mother and wife in the manner and tone. He doesn't appear to need a dominator, which is fairly common. I see a lot. When the daughter's speaking to me, her manner changes. I thought this was interesting. She's not disrespectful, but her tone is more sure of herself in English. She's polite, and I don't mean to imply she's not. But when she speaks to her father, it sounds, somewhat subservient. And to me, she's speaking more as an equal. Um, the daughter and the son, and one of the sons are the primary decision makers. This is usually a little different. This is different. Usually it's a son or a husband. The family denies any other health practices, except maybe they drink herbal teas, which I've seen in the room. They're familiar with terms such as impaco, which is a stomach ailment. My recommendation, be respectful. They value this. Use surnames. Avoid casual touching. They don't appreciate that. And you're going to have to ask a lot of questions to determine understanding, because they're not going to tell you, that they're not going to demand an explanation or anything. They're just going to nod and smile and say okay, or you're going to have to ask a lot of questions. The social relationships, encourage the family to be involved. They want to be involved, and this is something they need to do. The male, again, you're going to have to show a lot of respect to whoever is appears to be making the decisions, and it's usually going to be a male. The Be aware that the women are victims of violence in this culture, and it's a double-edged sword of the machismo. It gives the men a sense of responsibility toward their families, but along with that exaggerated sense of responsibility comes, how's my family seen, and is my wife respectful, my children respectful to me? I am the man. I demand respect. Women, they're involved in the care of the residents, and they're kind of seen as the source of the wisdom, the folk remedies such as cinnamon for stomach aches and along those lines. The religion, it's a combination of the Catholicism, which is a very symbolic religion. They have many rituals and rites. In this, it leads to an external locus of control, because the power seems to be outside of yourself. So you might have to involve a priest or a healer from the Hispanic community especially for some of the older Hispanic patients. It's not universal, and you may have to, you're going to have to determine where, if there's a lot of acculturation with this particular patient, that tends to lead more to an internal locus of control. It's going to be a continuum. You're going to have to determine it for yourself in this one. The healthcare beliefs, the hot and cold can kind of really, it leads to a denial of diseases, because you either feel good or you can, fix things by just eating hot foods with a cold disease. If they feel fine, they just deny it. There's not a lot of proactivity there, and this again comes from, with more acculturation to America, then this starts to change, and they will start to take care of themselves more. And again, it's on a continuum. The healthcare provider, you need to involve the family in the pregnancy and children. This is very important, especially with dying patients too. The families are involved. family support is definitely the one universal. If there's anything about Hispanic culture, this is it, the number one. Um, the women tend to do most of the care with the residents. The men are there, but they're usually there for support. And the men are often the decision maker. Female members will call the male or defer to him most matters. One of my residents, I asked a female member of the family a question about her father, and she was the only one there and insisted on calling her brother at 2 a.m. in the morning to find out what he thought. Sometimes the men are inappropriate with the female staff. This seems to be kind of a common characteristic. Perhaps I've just seen it a lot. I don't have a large sample, and will accuse wives of infidelity at the same time. And I think this might come from, I must be a man and do what men do. The families are usually very respectful of the staff, and the only ones that aren't, I think, are very worried that we're not going to treat their family member because of prejudice, and that was the impression I got from a couple families that were really pretty wound up toward us just from the get-go. Many of the women are subservient. They listen to the men. And the patient, talk to the patient. They'll consult with the family. The family just sometimes will just answer for them. But they want to involve the family. The dying of a family. This is often denied until very near death, and I think that might come from the Catholicism partially, because it's in the hands of God. And my parents been a good parent. They're a good person. Why would God let them die? So they tend to deny it. I've seen it many times. Just recently, I had a patient that stage 4 liver cancer, and I only had her a day and a half before I had to send her to the hospital for being unresponsive. But when we spoke to the family about a DNR, it took them about 2 minutes to decide no, she was full code and there wasn't anything else to discuss. Final note, while I myself lean toward more autonomy of an individual or patients, I do admire the family structure and how they support each other and look to each other to help make decisions. And again, this is the number one characteristic of Hispanic culture. And the families are going to be involved and want to be involved, and the patients want them. I do see some verbal signs of abuse of women, and it bothers me. The one study that I was looking at, the important thing is breaking the cycle of abuse is to break the silence. The women aren't going to talk to me as a male much, but I can see their husbands are somewhat verbally abusive toward them, and it wouldn't surprise me if there's physical violence involved. As nurses, we're just going to have to be vigilant of this possibility. This culture has a lot of very strong positive attributes. I think this one might be one of the negatives. But thank you very much. Enjoyed presenting this. And these are my references.